Hello, it's Dr. Greg Marion here at One Spine Chiropractic, and today we're going to talk about some common causes of disc injuries. One of the biggest ones we see here at the office is a bulge disc. Spinal disc wear and tear with age. So over time, disc will dehydrate and the outer layer of the cartilage will stiffen. These changes can cause the outer layer of the disc to bulge out. Some protruding discs can be painless, but if the disc bulges out enough, it can irritate nearby nerves, leading to numbness, tingling, weakness, cramping, spasms, and even shooting pain down the arms and the legs. Age is the biggest risk factor for a lot of this bulging disc issues, making it more common in older people than in younger people. So improper lifting techniques accumulated with trauma from poor posture, even obesity or genetics. But also acute trauma can also lead to a bulging disc. Another type of herniated disc are bulge discs, which can worsen to the point of rupture or even cause serious symptoms. A disc herniation is more likely to cause pain than a bulge disc. Disc herniates when the outer layer of the cartilage tears and the softer inner layer of the material protrudes out of the disc. The disc nucleus will irritate nerve roots, causing painful inflammation that can affect your ability to walk or change your bowel or bladder function. Degenerative disc disease is one of the most common types of disc injuries. It isn't generally considered to be an acute onset problem, but degenerative disc is an age-related condition which in the disc of the spine wear down over time and get smaller. When this happens, the holes on the side of the spine, which the nerves exit to, get smaller, which can put pressure on the nerves and cause symptoms. Besides repetitive motion and wear and tear, other risk factors that accelerate its progression include being overweight, obese, smoking. Common symptoms that we typically see are lower back pain, but the radiating pain goes down the legs and the hips. That is known as sciatica. A lot of issue comes up in the neck. We have some radiating pain down the arms called radiculopathy. Depending on how much nerves are being affected, this is something we want to get to right away and get some treatment as quick as we can. It is important to understand that degenerative disc disease cannot be reversed. It can, however, be managed and its progression can be slowed down. Chiropractic, spinal decompression, and exercise are three fantastic treatment options that can improve range of motion, decrease pain, and increase your overall function. Since a condition cannot be fully corrected, the goal then becomes achieving and maintaining the highest quality of life possible. A chiropractic lifestyle can help make that a reality for you or for someone who is suffering from degenerative disc disease. Another term that we associate with disc injury is a slip disc. A herniated disc is often referred to as a slip disc. When the outer cartilage becomes weak and tears, allowing the inner gelatin layer to center the disc to slip out. Age is a primary factor of this common condition because of general wear and tear of the disc, but certain repetitive motions or improper lifting techniques increase the risk of slip disc. An untreated herniated or slip disc can lead to permanent nerve damage. That's why it's very important to have any discomfort examined by a chiropractor who could perform imaging if necessary to get to the root cause of any symptomatic pain. Repetitive motion stress. As we mentioned earlier, disc injuries are commonly the result of a gradual process of wear and tear on the cartilage rings around the nucleus. It isn't so much the incident when you feel the pain, but rather the thousands of movements prior to that, which slowly damage the disc over time. For this reason, certain fields of work tend to have more disc injuries than others. One such example of this is hard labor jobs, such as a roofer, mechanics, or laborers who are bending and leaning over in a position all day, every day. These jobs require lots of bending, lifting, and twisting motions, as I mentioned earlier, which frequently through each shift, they accumulate with time. So they put the spine in flexion forward, rotation at the same time, and then this is a primary mechanism which through the bulging disc comes out and causes a lot of irritations and herniations. Lifting weights is a fantastic form of exercise that has been shown to provide numerous health benefits, both physically and mentally. However, heavy lifting also places a great deal of stress on the body, and especially on the spine. Our spine is always bearing the weight of our head plus the weight of gravity. When we add weight on top of that, we increase the load of the disc in our spine. When a heavy lift is performed, it sharply increases intra-abdominal pressure, which also increases intra-abdominal pressure in the spine. If there's a pre-existing weakness in the disc, then the likelihood of that bulge or herniation drastically increases. So we've got to make sure we're lifting properly, and if we're going to be lifting properly, use belts when needed. It is important to remember that heavy lifting doesn't just occur in the gym. People move furniture around their houses or move houses altogether. There are many circumstances in which lifting is necessary. If lifting is done improperly, though, the discs are increased risk of getting injured in the process. Lifting should always be done primarily with the legs rather than the bending at the waist or using the back. This is the best way to avoid unnecessary stress on your lower back. All right, another form of disc injury we see here are from auto accidents. It's important to remember that disc injuries can happen in other parts of the spine than just the lower back. The cervical spine, which is also known as the neck, is a common place where disc injuries can occur. One of the most common causes of disc injuries in the neck is auto accidents, especially when whiplash is involved. Whiplash occurs when the head moves violently back and forth in response to the impact of an auto accident. It damages the muscles and the ligaments around the cervical spine and even can cause damage to the disc as well. Symptoms can include neck pain, arm pain, numbness and tingling down that arm, burning and even weakness in that area. Another type of disc injury is from respiratory illness. In the midst of the pandemic, the world is very clued on the respiratory disease such as COVID-19, the flu, or even the common cold. Everyone is hyper aware of each of these everyday symptoms they're experiencing. With respiratory illness such as these, it is widely known that the two most common symptoms are coughing and sneezing. Unfortunately, these two activities have the potential to cause problems for the disc and the spine. Coughing and sneezing are the two actions that require a sharp increase in intra-abdominal pressure. And an increase in intra-abdominal pressure leads to increased pressure in the spine and therefore in the disc. If there is already damage to a sustained disc, then it's possible that the bout of coughing and sneezing that lasts a few weeks can cause further disc injury due to the constant spinal pressure being applied. If you feel this way or you have experienced this, call One Spine Chiropractic because we're here to help and provide the course of care to get you non-symptom free following your illness.